Okay, so now slides are visible.
Yes, sir.
Okay, Phakka Roga is only one disease or only one nutritional major disease which is explained by Kashyapa in the field of comorbidity. If you see Kashyapa, he has not mentioned any other nutritional disorders. We get the reference of Balashosha, we get the reference of the Parigarbhika and Karsha, etc. But these things are not mentioned by Kashyapa. The one and only disease related to nutritional or Kuposhanajanya Vyadhi mentioned by Kashyapa is Phakka Roga. So we should have a crystal clear understanding of this disease. Now, when we look into the classics in the Phakka Roga, we find two important definitions. Among them, one can be called as a derivation, nirukti, and another one can be called as a definition. Now, basically, Kashyapa says that Phakka means two important things are there. Number one, he says that Phakke iti nicher gacchati. This is the derivation given, nirukti given. What is the meaning of this particular word is a disease condition or a clinical condition or any other clinical scenario where a child is coming to you with the continuous deterioration of the general health status, then that should be considered as Phakka. This is the first derivation. Any child coming to you with slowing down in the growth and development, any child coming to you with continuous deterioration day by day, the health status of the child is coming down. That condition should be considered as Phakka. Okay, so in other words to say, you can also say that this is called as running down health condition of the child. This is the meaning of the first derivation. Okay, another definition told by Kashyapa is this one. That is, Bala samvaksarapanna padabhyam yona gacchati sa Phakka iti vijneya tasya vakshami lakshanam. In the Phakka Chikisa, he says that. Bala samvaksarapanna padabhyam yona gacchati. Child is not able to walk even after 1 year of age. Again in Sharirasthana, Kashyapa very clearly says, Samvaksarat upatishtati, vachancha prasrajati. By the end of 1 year, a normal child will start walking and also start telling some of the words. Vachancha prasrajati. So that indicates the normal development or normal developmental milestone. This is explained by Kashyapa itself in Sharirasthana, first chapter. Okay, so here he says that Bala Samvaksarapanna, even after completion of 1 year, if the child is not able to walk, then that condition should be called as Phakka. The word meaning of Phakka is crippling. ठीक है, फक्कत्वा या फक्का इति क्रिपलिंग है, उसका मीनिंग है, मतलब रेंदने का जैसा है या चल नहीं पाता है. ठीक है, तो these are the two important definitions that we will have. One is Phakketi nicher gacchati sa Phakkaha, and another one is continuous deterioration of the general health status of the child, or another one is even after attaining 1 year of growth and development, child is not able to walk. So second definition, when we see second definition, Bala samvaksara panna padabhyam yona gacchati, that is, child is not able to walk independent steps. So what we expect usually is samvaksarad urdhvam pratitishthati. By 1 year of age, child should be able to walk 1 or 2 steps independently. Okay, so if the child is not attaining this particular milestone even after the completion of 12th month of age or 12th month of chronological age, then that should be considered as Phakka. Now, second definition, if you look into that, it clearly suggests that there is a delayed developmental milestone related to the motor milestones. ठीक है, काश्यप ने जो बताया कि बाला संवत्सरा पादाभ्याम योना गच्छति, मोटा गच्छति, गमना, motor milestones. So he clearly says that there is delay in the motor developmental milestone, motor domain, gross motor developmental domain. So usually it starts immediately after birth, isn't it? Head control, neck control, okay. So then rolling over, so then sitting without support, with support, then sitting with support, then standing with support, standing without support, standing without support, and then standing, then walking few steps, then running. So these are all motor developmental milestones. These are all motor developmental milestones. So he means to say that child, if he is not able to walk even after completion of 1 year, means the motor developmental milestones are delayed and child has got some problem in the motor domain, gross motor domain. Okay, so there is delayed developmental milestone related to the locomotor system or muscular system. So this clearly suggests that there is immaturity of the pyramidal tract and central nervous system. So if this is the case, because we know that after 1 year only usually child start walking, isn't it? Question comes, why child is not start walking before 1 year? ऐसी एक logical question है. Usually the contemporary science is that the maturation of the pyramidal tract will be get completed by at 1 year. Okay, because the lower motor nerve system, upper motor nerve system, which is supplying from the central nervous system, it is very important for this particular thing, and that will be get matured only after 1 year. And Babinski's sign, okay, so plantar flexion will be only possible after 1 year, after the complete maturation of the pyramidal tracts or descending tracts. This is what they say. Similar is the case here. Even after 1 year also, if the child is not walking, means this particular pyramidal tract system is not matured. It is not matured means it may be because of some of the problem related to CNS, or it may be because of some of the problems related to the tracts which are carrying the impulse. Okay, so now ये birth asphyxia which is occurring at the time of the birth, or some of the CNS insult which would have been taken during the antenatal period, or some of the postnatal events, or some of the metabolic disorders, okay, or some of the chromosomal disorders, or some of the hereditary disorders, some of the syndromes. As a part of it, child may develop this particular delayed developmental milestone. Cause may be multiple. Okay, we cannot say what is the exact cause. Endocrinal problems may cause this problem. Chromosomal problems may cause this delayed developmental milestones. Some of the metabolic disorders may cause this. Storage disorders may cause, or mechanical problems, birth asphyxia-like condition, or infections during the antenatal period and during the postnatal period, or perinatal hazards. So many things can lead to this problem because of the damage to the motor cortex area, frontal lobe area, motor cortex area, primary motor cortex area of the brain. Okay, so therefore, standing was preceded by the rolling over. This I already explained. Standing is preceded by the rolling over, then crippling, knee walking, sitting, etc. So clearly the Kashyapa's definition very clearly suggests that there is developmental delay, especially in the motor domain. So two things are very clear. One is the condition of the baby is coming down rapidly, continuously, and it is also associated with the delay in the developmental milestones, especially gross motor developmental milestone, because he is not mentioned something related to cognitive domain, something related to the language, some language domain, or something related to fine motor. So such things are not explained. He will going to explain later, but in the definition it is not mentioned. So by the definition we can come to a conclusion that yes, this is a continuous fall in the general health condition of the baby, along with the delay in the motor developmental milestones, especially gross motor developmental milestones. Okay, so now this is what we get from the definition part. Now go to the next one. Now if you see this particular condition, so any clinical condition which is coming to your OPD, where the mother complained that my child is not gaining the weight, or my child general health is decreasing day by day, and he is also having delayed developmental milestone. ठीक है, ये तो मदर बोलेगी नहीं है, आपको एग्जामिनेशन करके देखना है. कोई भी बच्चा जब ओपीडी में आएगा, कंप्लेंट ये है कि उसका हाइट, वेट और हेड सर्कमफ्रेंस, चेस्ट सर्कमफ्रेंस, जो भी एंथ्रोपोमेट्रिक मेजर्स है, इट इज नॉट अप टू द एज. That means continuous deterioration of the general health condition, growth velocity of the child associated with some of the delayed milestones should be taken as a clinical condition of Phakka. Clinical condition of Phakka. Phakka is not a disease, it is a clinical condition, and that clinical condition may be seen in so many disorders. ठीक है, वो जो है कि मेटाबॉलिक डिसऑर्डर में मिलता है, एंडोक्राइनल डिसऑर्डर में मिलता है, एक जो है आपका बर्थ एस्फिक्सिया में मिल सकता है, कोई न्यूट्रिशनल प्रॉब्लम में मिल सकता है. कंडीशन क्या है? बच्चे का हाइट वेट नहीं बढ़ रहा है, ग्रोथ वेलोसिटी चार्ट फॉलो हो रहा है, ग्रोथ चार्ट फॉलो हो रहा है, और बच्चे का डेवलपमेंटल जो है डिले माइलस्टोन चल रहा है. अगर ये कंडीशन आपके पास आ गया, दैट शुड बी क्लिनिकली टेकन एज फक्का. वो हमारे लिए फक्का है. ओके, सो वी फाइंड सो मेनी कंडीशंस विद सच कंडीशन in the clinical practice that we will see. Now, how to understand Phakka when we say that there is a deterioration of the health status? So when we say there is deterioration of the health status, how you understand the Phakka Roga? Phakka is a clinical condition characterized by, this is what I already explained, just a repetition. Phakka is a clinical condition characterized by, तो इतना सब बोलने के बाद अब क्या समझ में आ गया? Continuous deterioration of the physical status of the baby. ओके, फिजिकल स्टेटस, दैट मीन्स ऑब्जेक्टिव पैरामीटर्स जो भी है, हाइट हो गया, वेट हो गया, चेस्ट सर्कम्फ्रेंस, हेड सर्कम्फ्रेंस, अपर सेगमेंट, लोअर सेगमेंट रेशियो, जो भी है आपका जो फिजिकल पैरामीटर्स को जो मेजर करने वाला जो चीज़ है, सो दैट हैज़ बीन नॉट अप टू द मार्क. इन शॉर्ट टू से द ग्रोथ चार्ट इज फ्लैटरिंग. ग्रोथ चार्ट इज नॉट अप टू द मार्क. इट इज नॉट अप्रोप्रिएट टू एज. Point number 1. Then you take that condition as Phakka. Okay. Number 2. There is continuous deterioration of the mental status of the baby. Okay. Of course, definition में mental status का उसने कुछ नहीं बताया. But according to our Ayurveda principles, if the physical body is decreasing, that suggests that always there is also involvement of the mental status. But the involvement of the mental status, he explained the clinical symptoms. But definition में नहीं बताया, but it is very clearly mentioned in the clinical symptoms that we will see later. So second is deterioration of the mental status of the baby. Number 3, there is delayed developmental milestones, especially that of the locomotor system. Okay, और बालः संवत्सरापन्न पादाभ्याम यौन गच्छति. 1 साल हो गया बच्चे को, उसके बाद भी बच्चा नहीं चल रहा है, तो दूसरा पॉसिबिलिटी ये भी है कि देयर में भी रिग्रेशन ऑफ द डेवलप्ड माइलस्टोन्स. डेवलपमेंटल माइलस्टोन्स जो डेवलप थोड़ा बहुत हुआ था वो रिग्रेस भी हो गया. सो देयर इज ऑल्सो रिग्रेशन ऑफ द डेवलपमेंटल माइलस्टोन्स. ठीक है, चाइल्ड इज एबल टू डू द रोल ओवर इन 5th month itself, but unfortunately child is not able to stand without support even after 12 months. So what is suggest that up to rolling over the delayed milestones, up to rolling over developmental milestones are okay. But afterwards, the motor developmental regression occur. Therefore, even after 12 months also, child is even not able to stand without support. Stand with support. Stand with support, child should attain by 7 to 8 months. But after 12 months also, child is not attained that. What suggests there is regression. पहले ठीक था और उसके बाद suddenly regression हुआ. Next, there is drastic fall in the anthropometric measurement. Phakka also suggests that there is a drastic fall in the anthropometric measurement, maybe head circumference, chest circumference, and mid-arm circumference, and what are all the criteria जो भी है हमारे पास, biceps thickness, triceps thickness, whatever you take. Then, in other words to say, there is growth velocity chart shows significant fall in the growth. Significant fall in the growth. So there will be recurrent infections which adds to the further growth failure. Whenever a child has got deterioration of the body status, usually the body immunity falls, and as a result, there is deterioration of the health status of the child. And as a result, so there will be recurrent infections occurring. So now ultimately, when such recurrent infections occur, child usually land up in a condition of immunocompromised states in the due course of the time. So clinically क्या है कि बच्चे का ग्रोथ चार्ट फॉल हुआ है, मेंटली बच्चे का जितना डेवलपमेंट होना नहीं हुआ है, डिलेड डेवलपमेंटल माइलस्टोन है, ग्रोथ पैरामीटर सब गिरा हुआ है. ठीक है, बच्चे को बार बार इन्फेक्शन हो रहा है और उसको डिसीज हो रहा है, और बच्चे का इम्यूनिटी बहुत वीक है, दैट इज इम्यूनो कॉम्प्रोमाइज्ड स्टेज है. एंड क्लिनिकली वी कॉल दिस कंडीशन एज अ फेल्यूर टू थ्राइव. Clinically, we call this condition as a failure to thrive. Okay, failure to thrive start from failure to thrive का एक end क्या है? If the child is not able to gain the growth velocity chart as per the age, मतलब एक 10 kg होना चाहिए था एक साल में, नहीं है, बच्चे का वेट अभी 8 kg है. Clinically, it is called as failure to thrive only. This is the initial stage, starting stage. ये आगे जाते 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 चाइल्ड इज सो डेबिलिटेटेड, ठीक है, उसका ग्रोथ चार्ट इतना फॉल हुआ है कि चाइल्ड इज बेड रिडन एंड अबाउट टू डाई. दिस इज ऑल्सो कॉल्ड एज फेलियर टू थ्राइव. वन इज द स्टार्टिंग पॉइंट ऑफ द फेलियर टू थ्राइव, अनदर वन इज द एंड स्टेज ऑफ द फेलियर टू थ्राइव. So usually such conditions are called as a failure to thrive. Failure to thrive is a common condition, FTT. Okay, it's a common nomenclature which is used. Okay, it includes many things. So clinically we can compare a Phakka like stage which is explained, or Phakka like word which is explained in our Ayurveda, to all the clinical conditions which are coming with the FTT. Cause may be different, cause may be hundreds of causes, but clinically it is nothing but a failure to thrive like conditions. Child is not thriving well, that is Phakka Nicher Gachati. Child is not thriving well. Okay, so this is about the definitions of a Phakka Roga and how we have to understand it. Okay.